Smartwatch Technologies. Can we please have a short introductory video by our partner, please, on the screen? Can we please have the video?
Smartwatch. Excellence is central to everything we do. Hygienic, sustainable, and spotless. Hospital laundry, on-campus laundry, and linen management service. Let's have a quick look at how it's done.
Here we bring the linen in a specialized vehicle with separate laundry bags for the dirty linen. Once the linen arrives at this facility, the linen is segregated as per its textile nature and soiling nature. Then we send these separated linen to different kind of washing machines. In washing machines, we have state-of-art washing machines. Thereby, we have separate programs for bed sheets, for blankets, for OT linen.
It is then conditioned to harmlessly remove spots from the cloth using a specific sorting machine. The sorted laundry is then washed in the state-of-the-art washer extractor that uses its auto-dosing system to drop just the right amount of eco-friendly and enzyme-based detergent in the water by detecting the weight of the cloth in the machine.
Linen is washed in each wash cycle, and each and every wash cycle every time gets the same amount of dosage, and all the lots remain the same.
The linen is then hygienically cleaned with advanced thermomechanical treatment and wet dried by the process of tumble drying. And if any linen requires tailoring, it is sent to the stitching station for a quick fix.
After washing, the linen is dried in the racks. The flat linen is sent to the flat work ironer, whereby it dries and it is ironed simultaneously. Here we have a very sophisticated folder and stacker as well. So that once the linen is fed, the flat bed sheet, they come out in stacks of 10 bed sheets, folded and ironed completely.
Now, when all is done, the laundry is folded, stacked up in groups, weighed and packed for delivery to their respective location in a sterilized and non-contaminated trolley. The transported linen is organized in a store of delivered location, where alternate slots have already been taken care of for linen needs, while the dirty ones come over all fresh, clean and well maintained. And that's how we do a quick smartwatch.
Thanks so much for the video. Following to it, I'd like to call upon the stage Mr. Rakesh Sharma, Managing Director, Quick Smartwatch Technologies. Can we please welcome Mr. Sharma with a round of applause? And can we also have a presentation on the screen?
Good morning, namaskar everyone. We're just hearing the inaugural panel, and everyone must be thinking what we are doing being into the non-clinical business. So basically we are young people who have founded this company. Fortunately, this year we are turning a decade old. My profession, I'm a chartered accountant. I have done my MBA also from Bangalore before jumping guns into this business. We understood that there are few medical services required which are beyond clinical services, the hardcore reality of clinical services. And we zeroed in that linen management is one of our very serious, we tried to address the irregularities and the quandaries into the linen management and let the healthcare focus on the prima facie business, on the core competency, which is the clinical services. We formed this company in 2010. We did a lot of R&D when it comes to linen management. All of you are from the clinical section when it comes to healthcare. India as a country, we all know what is the percentage of HAIs. Out of this HAIs, infected linen management is the third highest HAIs after catheter and urinary tract, all those things. I'm not very versatile with healthcare terminology, but yes, it accounts to a very, very big challenge. The doctors, the surgeons plays a very crucial role when we come to healthcare treatment of patients. But the duration of the doctor interacting with the patient directly on a one-to-one basis on the entire day of 24 hours is very less. After the nurses, it's only the linen provided by the healthcare facility which is always in a direct contact with the patient. We let the healthcare focus. Laundry building is a very capital intensive, lot of government regulations are flowing into it. It's a sad picture that most of the linen management in the company are not PCB compliant. So over the years of time, over 5-6 years since we are doing linen management, we understood this over the process after evolving ourselves as a company and today as the most leading and preferred linen management company across the country. I'll take you through a small presentation of 2-3 minutes what exactly we do. So we call it medical boundaries, medical care beyond clinical boundaries specifically. Next slide. So the journey started 2013. So this year we will be marking our 10th anniversary. We started with campus laundromat business. You must have seen this coin laundry overseas. We did this for 2 years, developed 50 campus laundries. We name it any good institute of the country, we are there, 𝗦𝗽𝗲𝗑𝗧, SRM, VIT, Manipal. And then we thought, what next? Then 2014-15, we thought, let's try out healthcare. Nobody was ready to do this job. The job which we do is directly proportionate to the occupancy of healthcare also. So, technically speaking, we understand what hospital and how the hospital is performing. In a summary, we call it incorporating technology, bestowing a better life to the linen, saving your valuable time of the clinical hours of whatever service a clinical healthcare person is providing in the hospital, and that too with complete care of the environment. The company's motto, we call it C3, Care, Commitment, Convenience. We are the most adaptable company and we can build whatever is the specific requirement of the healthcare. Apart from the core service of providing, we believe taking care of the nature is the utmost important. We take great pride in stating we are the only company till date and time in this country to be ever awarded by CINET, world's largest textile care body, as India's most sustainable laundry ever. All our central processing units are green building approved by Chen. So these are few proud things which we do. We recycle almost 4.5 million liters of water every single day. So that's something huge. We enhance the life of the linen by more than 30% by protecting the lint emission from the linen with a better technology and using an enzyme-based process to it. So this is our journey. We started 2013, as I have said. 2018 actually we forayed into linen management, and that day we are catering I think something around 2,500 to 2,600 beds. We are proud to state in a span of 5 years we have almost done that 10 times. And for next 2 years we are signed up with so much LOIs that in next 2 years we are again doubling it to 50,000 beds. Imagine. The second best service provider from us probably is less than 1/18 to the quantum we are handling per day. So this speaks, we proclaim this now, that we have built the trust cleanly over 9 years. This is how currently we are positioned. Definitely South India plays a very crucial role for us. We all understand the reason. We are expanding North India, Punjab, Delhi surrounding. This is how we are going to be 2024. Prior to this, there was a slide, we missed it. In 2020-21, we have also partnered with one of the leading healthcare allied service provider on planet Earth, 𝗓𝗏𝗡 Corporation. They are a Japanese-based company. And recently, Mitsui has also boarded us for the same. So what is linen management? The dictionary can go on and on and on. So what we have summarized, it cannot be an opinion. The top management cannot think that, look, tomorrow I can outsource this entire. It has to be a culture. We need to develop this culture. We need to think it, being from the commercial perspective also, we need to think on the P&L of the healthcare. When we talk about the P&L impact, the cost of a complete automated outsourced healthcare per occupied bed is less than $2.5 a day. Wherein you can outsource the linen, the management, the manpower, the incoming, outgoing, discard, everything the service partner manages. Imagine at a cost price of $2.5 a day, which is third highest HAI in the country. This is what our team actually loves it. We have termed it as a second skin. God has given us a skin as a barrier, to protect our body. This second skin needs to be taken care in the most ultimate fashion so that the length of the stay can be reduced. Definitely there are clinical ways which can be also done to reduce that stay, but this also plays a very, very crucial role, and we take proud in stating that there are hospitals where we have proven this factor. There is a department in each and every hospital, we call it PCS, Special Care Service. We, over the year, with multiple clients, have built, and so I personally interact a lot with ICNs and patient care department HODs. So we have built what we call patient care perception, and we have tried to incorporate a wow factor into the entire ecosystem. This is how you can make your patient. We talk, a lot of hospitals, every hospital rather talks a lot about being patient-centric, providing this, that. This also plays a very, very, very crucial role when you talk about patient care service or patient care perception. So, what we see is not a hygienic linen in healthcare. We may see very bright, it may smell good, so that there can be an outsource of outside elements which can make you feel. But is it a hygienic linen which is actually required for a healthcare? Absolutely not. Multiple vectors which bring in the infections in healthcare, everyone is aware about them. Linen accounts a very important factor into this. Innumerous reports are available since 2013 till day before yesterday. By WHO, ICMRA, you name it, they can provide. And we can keep on speaking about the reports maybe for next 2 nights itself. The bacteria which holds inside the linen can live a life up to 100 hours. Imagine how dangerous that can be if it is not well treated. There are various study reports available on same. So we are very familiar with this picture. A doctor or a nurse wearing a gloves, a mask, a headgear, an eye shield. Why do we do this when we go near to a patient? The major reason, apart from the clinical part, is to try to prevent or create a barrier between the so-called infectious carryover from the patient to the person, the nurse or the doctor nearing to the infected patient. Similarly, we have tried to build this concept into the linen management process. So we try to operate on a barrier model or a straight line flow. Many people must have visited the laundry where you see a washer extractor or a dryer opposite to each other. Most incorrect way. It has to be a straight line process flow. Barrier concept, the soil linen enters from one side, the clean exits from other side, the door cannot open together at one given point of time. This is how actually the linen flows in healthcare. The linen comes in, we transport, we sort it, we process it, we clean it, dry it, fold it, repack it, again ready for dispatch. So what does the barrier concept helps? It helps into cross-contamination. We build OT with a lot of HAVs, controlling the air control and everything. We should build a laundry similarly. This is what is linen in summary, a linen management in a healthcare actually means. The red part are the soil part or unclean part, and the blue and the green circle is again the clean part. This is what we actually bring it on the table for any healthcare center or institute. We let them focus on their core competencies, creating a wow factor with a better patient care perception. This is what we have for everyone. These are the healthcare centers which have actually made us healthier also. This was all from us. Anything you would love to answer on that? Thank you.
Dr. Aashish wants to ask some question.
Definitely, sir.
Similar mechanism few years ago. Just wanted to know how do you maintain are you responsible for maintaining the power of the hospital?
Absolutely. Everything comes into it, the discard, the power, the uniform. We call it 3 categories of linen to be utilized in the healthcare. First is flat linen. Second is uniform. And the third is OT linen or the CSST.
Responsible for
Everything, sir.
the linen
Yes.
as well for the hospital.
Yes.
And how do you differentiate other hospitals related to the RFID?
How it can be RFID. What is the need of the hospital? That is how we maintain it. We can tag it, mark it. All the central process unit. Currently we are present in 9 states and catering more than 69 hospitals. In one unit we cater more than 7 to 8 hospitals. And we are doing it fantastically, sir. Thank you. No issue, sir.
The whole India needs cleanliness. He said that cleanliness is godliness. Medical knowledge. Because the idea has to flow from the out. Corporates are, the Indian healthcare is not very much regulated. It is a cost effective as well. But the real medical education comes in the teaching hospital. So maybe cheaper. You said all India is to let us join hands with the government and non-profit organization so that the whole India will become quite washed.
So, I'll say you, sir, we have been after the life of central government of India for last 3.5 years. You'll be surprised to know that AIIMS, so we thought that being one of the most, considered as the pioneer institute in healthcare in India, we made the government understand this. All the AIIMS, upcoming AIIMS, 22 upcoming AIIMS, expression of interest has been floated by HLN, will have an outsourced linen management process. And we are doing this. Apart from this, there are a lot of CSR which we do. As a company, we donate, we should not mention, a huge number of dialysis, with the partners which we are doing. On a personal front, like I am also associated with Shankara Eye Hospital due to some personal reason. So as a company, we have done an OT there, and every year we donate more than 100 eyes to that institution. So that is something on a personal front and as a company we are doing. We believe apart from the service, apart from the sustainability to Mother Earth, as a country, we should always give back to society what we have taken from them. My education on a different personal notes has been through a lot of charity. So I believe you should always give it back to the society for making the next generation more stronger. This is how we can make our India.
So kind of, but it is not a railway hospital, but the railway will have,
Yes, yes,
yeah.
of course, yes.
All that is not given is lost, do well, health will.
Thank you, sir. Thank you.
I would request Mr. Sharma to please stay on the stage. Thank you so much, Mr. Rakesh, for your engaging and informative presentation. I would like to thank and felicitate Quick Smartwash for partnering with us as our presenting partner. I would now like to call upon stage Dr. Navneet to hand over the partner certificate to Quick Smartwash.
Can we please have a round of applause for our presenting partner, please?
Let us now move on to the first session for today. The healthcare industry has seen a significant transformation over the years, and technology has played a crucial role in this transformation. The COVID-19 pandemic has highlighted the importance of technology in healthcare and specifically in the operation of hospitals. With the emergence of new technologies, hospitals have become smarter and patients are receiving better and more efficient care. In this context, the role of emerging technologies for building smart hospitals is of paramount importance. We will be discussing the various aspects of this subject during our panel discussion on role of emerging technologies for building smart hospitals, CXO's perspective. So without further ado, I would like to introduce our panelists for today's first discussion. For this session, we are honored to have our eminent dignitaries present. Ladies and gentlemen, with a big round of applause, I would like to welcome Commander Navneet Bali, Senior Vice President in Group Health, Advocacy and Strategic Relations, Narayana Health. Dr. Ritu Mittal, Chief Group and Innovation Officer, Fortis Healthcare. Mr. Neeraj, Chief Operating Officer, Apollo Hospitals. Dr. Aashish Chaudhry, Managing Director, Aakash Healthcare Private Limited. Ms. Upasana Arora, Managing Director, Yashoda Super Speciality Hospital. Dr. Yung-Chung Chen, Associate Professor, School of Dentistry and Institute of Oral Medicine, College of Medicine, National Cheng University, Tainan, Taiwan. Mr. Rakesh Sharma, Managing Director, Quick Smartwash. Please put your hands together to welcome all our panelists for this session. Now I request Mr. Sharma to please take over this session from here.
Thank you. Welcome everyone once again to the most distinguished panel that we will be having. Definitely all the dignitaries and members present here are distinguished. It's a real honor to share the stage with such eminent personalities in healthcare. So the role or the topic which we are going to cover today, what is the role of emerging technology for building a smart hospital? It's a very crucial thing. We typically as an Indian, we Google a lot when it comes to healthcare. We try to see what is the latest thing. Every week, almost every single day, there is a new innovation in healthcare. When VOH and we decided to do this panel, I also tried to Google a lot. probably last 2 nights, and I thought the time spent on googling this topic is immensely short. It can go beyond our imaginations. Let's hear these eminent personalities. I've met few, I know few a lot, and I believe with their in-depth, deep ocean kind of knowledge, all of we can have a little bit of our own bucket filled up today for taking it back to home. So let's start from Dr. Aashish. Sir, you have been probably one of the fastest growing, definitely all due respect to all the hospitals, every hospital is growing very fast. In terms of North India now, I believe you all people have also set up a new institute at Uzbekistan and doing fantastic. So what is your initial takeaway when we talk about emerging technologies for healthcare?
Okay, if I talk about the emerging technology, I think when I was in the process of building the first hospital, I was always thinking it should be a paperless thing, it should be smart in all aspects, and digital innovation, everything should be in place. But when you actually start working on the ground, reality is very different. In the Indian context, you have to look at so many other factors, including the cost of implementing those technologies, including the acceptability among the healthcare professionals. And when you are starting a new organization, the first and foremost aim is to survive, and then focus on trying to make it more digital and communicate through a distance. So after 3.5 years, 4 years, we realized, okay, now we are able to survive. Now what to do next? How do we add on the patients to the already existing pool? How do we improvise the processes? So I feel that any technology which is going to be helpful for any healthcare institution has to have, they should bring about change in patient outcomes. They should also streamline the various processes which are already existing, should make it better, 2 or 3 notches better than what is already existing. And of course the patient experience has to improve. Otherwise, if any of these 3 goals are not being met, it's not going to be a sustainable model to invest in such kind of technology. Telemedicine is one of the most common thing which almost every hospital has adopted, forcefully adopted during COVID, and now gracefully continuing with that. So that's something, but it is still so many things which can be done in telemedicine. I think a lot of big chains have got a separate vertical in telemedicine like Apollo, and they are doing fantastic work. They have started using drones, they have started using chatbots to respond to so many queries from patients coming online, especially the mobile platforms. So I feel that that's something which can be adopted and nurtured on a long-term basis. The other thing is the robotics usage. Surgical robots, everybody knows it's coming big way in laparoscopy, bariatric, liver, donor surgeries. And also now, people are talking about, there was a big range of robot in COVID times, no-touch technique, how to register the patients, when there are chat robots available. And also, the disinfection robots are also coming up. Although, it's still in the incipient stage to actually adopt in a healthcare institution where, just like Indian roads, healthcare buildings are also unpredictable. Today we have a department here, next day we change it somewhere else. So we have to keep evolving in terms of adopting such technologies. And the virtual reality thing is also coming up. So I also had a very close experience in doing a virtual surgery in an open space. Somebody looking at me would say it's gone mad. It's sitting idle and just moving the hands. But actually it's an experience which is going to reduce the need for wet labs in future, which is also already a difficult thing to achieve. Most of the medical colleges are also finding it difficult to run a wet lab. So these are few of the technologies which can bring about improvement in those things, bring about improvement in patient outcome. Tele-ICU has also come up in a big way. So I feel that all those emerging technologies, whichever is adopted case-to-case basis. There may be few technology which may not be very good for us, but it would be good for a tier 2 or 3 healthcare institution because they want to connect to a big hospital in Delhi to take care of the super specialist care. teleradiology has been established big way. So these are the things which any healthcare institution while adopting, they should see their need. They should have their assessment, the discussion with the clinician, their adoptions and their acceptability, and then plan their own way of innovating and bringing about digital change in their institutions.
Thank you, sir. I fully agree. Being a financial background, that P&L is always challenging for any upcoming organization. Ritu ma'am, what you, from a unit to a corporate, like I had a talk with you, what are the current technology upgradations when we talk about AI, robotics, IoT, MedLab? What do you think can be the most sustainable format for an organization like Fortis or a bigger corporate organization? And what are the key upcoming technologies which are being accepted very fast?
Thank you. So I will divide it into three different kind of technologies. So one is core clinical. So any technology which is helping clinicians give more precision will continue to evolve. I think that is how we evolve from open surgery to lab surgery to robotic surgery. We want to be as precise as possible and minimize collateral damage, get the patients back home early. And that is, same in radiation. So Proton or Fortis is bringing India's first MR-Linac very soon. Idea is again get as precise as possible, minimize the collateral damage, and get patients home faster. So any such technology would get adapted earlier and faster. Second would be early diagnosis. We're seeing a paradigm shift in genomics. We've been hearing about genomics for a very long time. A lot of people have skepticism. They all feel that it is somewhere there, it's very futuristic, but actually it is not. For any of these technologies, it takes like a decade, and then it reaches a tipping point. And once it reaches a tipping point, that's when it explodes. And we do feel that genomics is somewhere there. We do expect CAR-T cells to come and actually absolutely change how leukemias and lymphomas are treated very soon. Probably some of the companies are likely to get FDA approvals as well as BGCI approvals this year, and there's going to be a paradigm shift in how blood cancers are treated. Those technologies are very expensive today. They will be very expensive in first 2-3 years, but there is enough evidence, global evidence, to say that if you get to a scale, then they will become much more affordable. And I think that is how medical evolution has always happened. The second very interesting thing is this whole upcoming of 5G. So we've been in talks with some of the telecom companies, the large telecom companies who spend like billions and billions to buy the spectrum and working on 5G. When we talk to them, one of the very strongest use cases for 5G is healthcare. Now they are also trying to figure out how they can enable the hospitals to reduce and make it as real time as possible. So the next level of telemedicine is going to be much more live with like a millisecond sort of delay. And we've been talking about can the ambulances be live? Can there be a live transmission of patients in the ambulance as well as the live transmission of data in our ERs? How do we get all these IoT devices? There are many of them today. Currently, they've not been very successful simply because of bandwidth issues. So all of the hospitals also have to upgrade the base infrastructure, and to Aashish's point, it does involve significant cost. But eventually, once that investment is done, that will open up a layer of data and information on which we could do so much more on AI models. All of us, I think, are also thinking about data lakes, data transformation, making sure that we have unified and homogenized the data and getting ready for this National Digital Health Mission, which will again be a game changer. So in all these three buckets, data, 5G, clinical, core, precision-driven, clinical technologies, it is definitely a very exciting time.
Thank you, ma'am. So that means, in a summary, more of a preventive management with more upcoming gene editing, trying to deliver to the last possible mile. Outstanding. Commander Bali, I'm personally a very big fan of sir. His attitude not to say good night on the last second of 24th hour of the day always inspires me, and I always, emphasize how he finds this energy. Taking forward, sir, how do you think, technology can help, apart from the clinical front, a hospital in, bettering the EBITDA or the so-called bottom lines, being on the administrative front, how do you think technology helps us in achieving what we all as a businessman look forward to?
Thank you very much. At the outset, I would like to thank Voice of Healthcare for inviting me today here. It's a great privilege and honor to be sitting amongst such wonderful panelists. Thank every one of you sitting here today to listen to us. So, more than talking about EBITDA and bottom line and profit, I think I would just like to tell all of you about what is the problem that we're going to solve, or what's the problem that we're trying to solve using technology. We are 140 crore Indians. Out of that, 80 crore of us are not covered by any panel, do not have any insurance, and we have the world's highest out-of-pocket expenditure, which is around 60% earlier, but yesterday the report tells us that it's gone down to around 48%, which is still very, very high compared to 18% out-of-pocket expenditure across the world average. And also, let's get out of Delhi NCR and move to some of these smaller towns in Nagaland, Andaman Nicobar, Jammu Kashmir, Leh Ladakh, etc. And let's try to think about what digital can do about it before I come to your P&L and EBITDA. And what is the other problem that we're trying to solve? The problem we're trying to solve is to democratize healthcare. And how do you democratize healthcare? You democratize healthcare when you bring in accessibility and mobility to every last Indian living anywhere in the country. And what's the other way to democratize healthcare? When the financial condition of an individual does not determine the quality of medical care he or she gets. So that's problem number one. The problem number two is about trust. Trust in healthcare systems, trust in the treatment that the patient is giving. And to take a cue from whatever was spoken before us, National Digital Health Mission was spoken about, and the EMR and EHR that we're trying to develop. Just imagine a small farmer living somewhere in the remote areas of Assam or somewhere remote areas of Ladakh has a single number, and that number stores the entire healthcare records of that person, which he or she has the control on, and they can determine who can have an access to that number. And instead of having thousands and thousands of files and data collected and stored, which can be stolen, destroyed, forgotten, now you just have one single number where all your data is stored. And let us say you have an issue tomorrow where you're not able to travel. The single number can be sent. It can be accessed by doctors across India or abroad, maybe someday. And you can determine whether the patient needs to travel, doesn't need to travel, there's an emergency, there isn't an emergency, and the treatment can be given. So technology is a great enabler, and the only which way I speak about it often is if you want to solve India's healthcare problem, there are only two ways of doing it. First of all, don't make people fall sick at all. A 140 crore country cannot solve the problem by trying to make every sick person well. So you need to work towards wellness, but that's a separate discussion altogether. The second is using digital technologies where accessibility, mobility, accountability, trust, everything comes together. And the remotest corner of India, you have people who are able to give their own medical records for scrutiny by the outstanding clinicians sitting across India, and they're able to treat them where they are most of the times, or if they need to travel, then they specifically travel to a place where they get that excellent result. So this is as far as one part. Now coming to your EBITDA and bottom line and business and profitability, healthcare is a very different kind of a ball game. Of course, hospitals need to make money to be sustainable. I'm talking about the private healthcare, but it is much more than bottom line and profitability. Any which way, a technology initially has its own costs, as was spoken earlier, and many times these costs get passed on to the patient because who's going to pay for the technology? but again it was again spoken that when you look at scale, and as you all are aware, when Dr. Shetty started Narayana Health in 2000, there was only one dream on his mind: how do you reduce the cost of heart surgeries? And he did it only by using scale, where you could have in one particular day, one surgery happening in an OT, you had 20 operation theatres operating together like a, as he calls it, the Walmartization of the operation theatres. And you had so many surgeries happening. You went into efficiencies of using your sutures, your other consumables. You went into efficiencies of using your senior doctors only look at something and the junior doctors doing something, and all those things came into place, and that's how we went on to do it. So technology is the second, I would say, revolution which is happening across. Technology has the great capability of reducing the wastage of what a patient into a hospital goes through. And by wastage I mean all the time that the patient spends not with the doctor or going through a procedure or doing a radiology test. The entire thing is a wastage, because either he's sitting in the waiting room or he's waiting for the appointment or he's waiting to pay the bill. So when you use technology, all these things become seamless. You have efficiencies coming into play. You have many of those so-called gaps in your profit and loss statement. If you look at the costs, they become much more visible, and when they become visible, you can calculate them, you can look at them, you can determine how to reduce them, and when you reduce costs, then automatically your EBITDA and profitability increases. That's the answer to your question. So I think as we go forward, we're going to see a paradigm shift in. Actually, we have been talking about all these things for many years now. I think every conference I go, I talk about AI, ML, I talk about telemedicine, I talk about teleradiology, I talk about EMR, EHR, everyone for the last many years. But now I think we are going to see this actually happening on ground, and you will see this happening not only for all of us who are sitting in this privileged place in Delhi NCR, but in many remote corners of this wonderful and great country of ours. Thank you so much.
Thank you, sir. When we met, very well said. Actually, the meaning was never on the terms of bottom line. It was like, I've seen Narayana model very deeply, sir, concerning with other hospitals, corporate. And I really appreciate the model, the chairman carries on the shoulder, making it to the last person standing on the line. Technology can play a very crucial role when you, as a corporate, wish to intend to reach to multiple masses. Multiple hospitals is trying this, apart from the technology, clinical technology part, on making the hospital on a better run. Going forward, Upasana ma'am, welcome. When we talk about so much change happening in the next upcoming 1, 2, 3 years, what all the distinguished guests have said, panelists have said, how do you think the hospital balances, the emerging technology with the concern around data privacy? With all those things, a lot of data privacy has to be maintained. As a patient, nobody wants it to be breached. What is your thought process on the same?
Thank you so much. And first of all, I would like to thank Mr. Navneet from Voice of Healthcare who invited me here. This question which you have asked me, actually I was going to ask everyone that it is a big challenge when we are suffering from this data hacking, ransom attack, this and that, and we are actually depending on everything on net. Half of the things in a hospital who is actually not doing EMR, but still he is doing other things on computer only. And nowadays, all the machines who are coming for surgery or for some kind of procedure, everything is related to data. You need to capture everything, then you can make a record and lots of things which is really good. Robotic surgery and I can say lots of things everybody knows who is sitting here. So, but question is this, and we want to make our patient very comfortable, as Mr. Navneet said, that we don't want that he should waste his time. He can, take an appointment online and then he can come. Everything is ready in the hospital. So how? We are going to use technology. So technology has really very positive effect, but same time there are few things which are negative. Like I was in a Harvard Medical School for some quality program, So I was talking to others who are actually doing everything directly on keeping their data on server and totally computerized, like Massachusetts Hospital and others. I was asking them, if something goes wrong, server is server. It can, anytime any server can, get down. So what do? They say we wait for that, and I asked them to how you manage to give medicine to patient, reports to patient. They said we are making a mechanism to manage this problem. So I told them that we in India, what we are doing both the things. We are doing manual also, then computerization. It is a double burden on our nurses and doctors, but still we are trying. So technology, when we start using anything, there are many challenges in every area you see. Like when we started this laparoscopic surgery, there are big problem. Doctors needs to train, then it is a challenge to convince your patient to go for laparoscopic surgery. Same thing happened with robot. So I think after some time, all hospitals are going to be totally e-hospital. Like this, we are already using, I think Dr. Bali must be using and my Neeraj Lal must be using. Best part is that all friends are sitting together. So doctors are getting patients vital on their mobile. So such kind of things are really good for patient care. But same time, I think within 6 months or year, our brilliant IT software engineers will be able to manage that how to secure data. Because of this problem, no one wants to share their data with even companies who are coming to solve your problems. Many companies are approaching me that we will manage your outpatient, then we will manage your this and that. And I am asking them, what is the guarantee that you are not selling my data? So I think time will give the answer. But same time, technology is really good and we are doing really great, especially Indian hospitals. That is why medical value travel is growing very fast, and India is going to be preferred destination for medical value travel. Thank you.
Thank you, ma'am. Very well said. And we all believe our brains would develop some of the best data privacy management apps. Going forward, we can be the leader and most preferred into this. Coming to Dr. Yang, welcome to India from our side. Taiwan, we all know, has been a pioneer into telemedicine. And we have heard a lot about this from multiple Taiwanese companies. What, according to you, would be the new technology which is going to being given by Taiwan to the entire medical fraternity on planet Earth?
Well, thank you so much for the invitation. It's my honor today to be here to share some of my experience. But me as a dentist, so I will focus these issues on the perspective of the dentistry. So basically, when we talk about the telemedicine, it's actually very difficult for dentistry because we are not like medical doctors seeing patients and listen to their chip complaint, and then we prescribe the medications. For the dentistry, as a dentist, we have to really see the patients and treat the patients and maybe do some local debridement to solve the issues. So for the dentistry, it's actually very hard to do the telemedicine. But one thing we have been doing is to apply the digital technology into the dentistry. The advantage of the digital dentistry is actually that can save a lot of time, and also that can increase the efficiency. And the most important thing is, especially like during the COVID pandemic, using the digital technology, since the accuracy has been increased, has been improved, what we can get is we can reduce the number of the appointments that patient has to come to the hospital. So I would take the dental implant surgery as example to explain that what we have been doing. So basically, right now in Taiwan, for the digital for dental implant surgery, patient come to us, then we do a like intraoral scan, a digital scan, so we can get the data of the oral conditions, and also we can do a digital CT scan. Then we can combine the CT data with the tooth data, so that we can virtually plan the surgery. And after that, we can design the surgical guide or the static surgical guide, so that we can place that in the patient's mouth during the surgery, or we can input all these data into the navigation systems, so that the doctors, they can do the navigation surgery, and they can place the dental implant into the correct positions. And after that, when we do the final prosthesis, what we can do is we do the scan, the intraoral scan again, so that the data can be sent to the dental technician right away through the internet, and then they can design the dental crown or even the dental bridge, and so that we can give it. And then once the design is finished, they will send the design back to our hospital, and we have our own 3D printer, or we have our own the mini machine, so that we can cut the materials, or we can print out the dental prosthesis in our hospital, so that we can do like one-day dental prosthesis. I mean, which means patient come to our hospital, the surgery in the morning, and then after surgery, he can take a rest, maybe have a lunch, and after the lunch, the dental prosthesis has been completed, and then the dentist will install the dental prosthesis in the afternoon. So in this way, we can further reduce the number of the appointments of that the patient has to come to our hospital. And also, the advantage of applying this digital technology is that we can increase accuracy, so that we don't have to, repeat the prosthesis if you do doing the traditional way, because the traditional way during the manufacturing process, there could be a lot of errors can happen. So using the digital technology, I would say for the dentistry, it has improved our workflow a lot. Yeah, thank you.
Thank you. So that means, Dr. on a personal note, I have a crown and I understand how many rounds we need to go to a dentist. So definitely I believe this will help a lot of people into saving the time and getting the procedure more faster. Dr. Neeraj, sorry for coming late to you, sir. So there are multiple things, technology, Apollo being one of the front runner in corporate hospitals in terms of number of bed. Any specific technology which you believe as Apollo has been doing live and that should have been done by multiple other hospitals? So technology which probably your people as a corporate field has been tried, tested, and there is a satisfactory outcome when we talk about patient care.
Very good morning and thank you very much, especially to the student from 𝗕𝗏𝗧𝗘𝗥𝗡𝗙 University. I think you are the future hospital managers, so you can use these inputs in the future hospitals wherever you are working. I'll take you 3 examples what we are doing in order to bring operational efficiencies into the hospital. There are so many things available, but what technology suit your hospital? I think that is more important. And the technology which is used in the betterment of patient care as well as improve the efficiencies of healthcare. I think that is the technology we have to use depending upon the hospital setting and all. Except for example, people talk about AI cameras. Everywhere people talk about AI cameras. In one of the hospital, we have used AI cameras to capture the emotions of the patients, emotion of the staff, and the emotion of doctors. So whenever a patient, I'll just give you example of a OPD setup. AI camera is installed and emotion is captured, maybe happy, sad or whatever. So a customer care manager sitting in the OPD scene, one of the emotion of the patient sitting in the OPD is sad and he's not very happy. She proactively goes to the patient and asks, what happened? How can I help you? And he got amazed how she came to know I'm not happy, I'm sad. So these are the things which is happening in our hospitals. Then patients say, I'm waiting for this doctor for past 1.5 hours. There was a problem of billing and all. Something like this. In the morning, a doctor entered to a hospital, his happiness index is 75%. While he is going out, his happiness index is 42%. He may get a call from HR head, hey doc, what happened? What we have done, workload is more or what? This thing is happening in our hospitals. So I think if we use this technology for all those things, one of the example I'll give you, there is something known as in every hospital we use nurse call management system. I don't know why this word use nurse call management system, because poor staff nurse has to go for each and everything which is happening into the patient room. Say for example, a room is not clean, a bed sheet is not changed, a TV is not working. So for each and every time a staff nurse is called, patient press the bell and you go in, and then she has to hear what patient has to say, come out and coordinate with a different department, maybe housekeeping, F&B and all. So what we have done in one of the hospital in Bangalore, there is a nurse call bell system, which don't say nurse call bell system. There is a 4-point system, which is a remote, like a remote of a TV, which is given to the patient, which is connected on a Wi-Fi network. In that remote is 4 buttons, one meant for nurses, one meant for housekeeping, F&B and maintenance. So if I got a problem with F&B or there is a need for F&B, I press that button and there is a tab which is mentioned there in the remote. It will take 10 minutes, 5 minutes and all. Automatically a message will go to F&B manager or a supervisor, and if he is not coming within 10 minutes or 8 minutes, whatever the tab is, immediately go to the manager of the hospital. So you can save on time, and it has been seen 33% of the nursing time can be reduced for this. She is not going to the patient room for this. Like in Apollo Ahmedabad, we started on smart rooms. Smart rooms, what we do in these smart rooms, generally, these days we have a family where nobody is sitting with the patients. So his daughter, wife, family friend, they come in the visiting us and he is all alone or she is all alone. So what we have done, some of the rooms, there is smart rooms, I want to hear some spiritual song. So a module is connected, patient is just supposed to say, I want to hear a spiritual song. Automatically the song will start. Please put off the light, please put on the light, close the curtain and patient feel very happy. All other thing except the medical can be managed by smart rooms. We are doing this. A third pain area in the hospital is a patient transport services. I think whatever you do, automation services, whatever you do, the transport is a big problem. From a ward to a OT to a recovery back to the special room. Or for example, from a ward to a CT scan or MRI. So what we have done, like cabs, what we use cabs to book these things, we have a patient transport services. What we do, there is 12 to 14 young boys and girls, a cell phone is given with a smart technology known as Porter app. So whichever floor require those transport services, they see which porter is close by. They press on that button, she arrive with a trolley or this thing and transfer the patient and leave them there. That porter is not supposed to wait for a patient, the procedure to be completed. And whichever close by, you can use the better efficiency of this and it can change the way we work in the healthcare. So these are the few things which we are doing and it is happening.
Thank you, sir. So that's probably bringing technology with the touch point of day-to-day life care. Great. Ritu ma'am, I'd love to hear from you. When we talk about growing technologies, growing it fast, probably next 2-3 years, how do we see India as a country where still the connectivity is so poor and more than 1/3 of the population is yet to have an internet connection?
That's not an easy problem to solve, frankly. So I do believe that the telecom operators and the government is working a lot in improving the connectivity and bandwidth. I do know that in general the connectivity in India is far better than many other countries. We have a lot of people who come from overseas and who feel amazed at the kind of work that they're able to do in speed. But I do agree with you that it is not uniform in distribution. But I do feel that with this whole UPI, financial transactions now happening at every remote corner of the country, and the upcoming digital health mission, which I personally believe can be a big game changer for India. I don't think any other country has done it at a scale that is envisaged. And it will have its roadblocks in the beginning, but I do feel that eventually in a couple of years we will get it right, and that will change everything significantly. Just as you can now do a 5 rupee payment in any remote manwala shop in any country. We're talking about somebody being able to access their health records and being able to have a uniform exchange of the health records across the organization insurance bills through the digital health mission. And a lot of this initiative is a multidisciplinary approach, which would need experts from IT, telecom, government, as well as players. And I think there are multiple ecosystems that are developing now through CII, where all the stakeholders are working to solve this. So I'm quite confident that this will get solved.
Thank you, ma'am. And we all are keeping the finger crossed. Commander Bali, as since you are associated with multiple government organizations, so how do you think the government can play a very crucial role, or what role the government can play, and what do you expect as a healthcare representative the government should play a role in terms of developing technologies, or what role they can play?
Well, thank you very much for that question. Never underestimate the power of policy making. 1666, London, the great bubonic plague struck, and people started dying. And the government thought that plague was being brought by cats and dogs. 400,000 dogs and cats were killed, and you know the disaster which happened, because actually plague was not caused by cats and dogs but by rats. And the cats which were killing the rats, and so it was a disaster. Cut to the present day, decisions can also be fantastic. The direct bank transfer to thousands and millions of Indians across our country into their banks, wherever government wanted to give some, cut out corruption in a very, very big way, and it resulted in huge amount of satisfaction. So policies are, by the government especially, the good policies by the government can have very, very catalytic effect. And we are very much aware that government is working now to bring digital health mission, integrating the EMRs, integrating the EHRs, bringing in an Aadhaar ID for every individual, just like your Aadhaar card, which you will be able to use across all portals, across all networks seamlessly. And so, as I said, never ever underestimate what policies can do. And I personally believe that despite spending 1.3% of our GDP in healthcare and having a huge problem because we don't have a very good tax to GDP ratio, but still our own problems are uniquely being solved by using technology. And government is a very, very important player, although 70 to 80% of healthcare in India is driven by the private healthcare. But as far as policy making is concerned, and to push everything together uniformly into one direction, is going to be something that is going to be a, as I said, game changer as far as democratization of healthcare is concerned. Thank you.
Thank you, sir. Dr. Aashish, I would love to hear from you, how you think technology can help in developing or bettering of the workforce for the healthcare fraternity or the ecosystem.
To talk about the workforce, I believe that in individual efforts, every institution or a healthcare establishment has got system software in place which takes care of the employee engagements, takes care of their attendance, and a lot of other aspects. Very fantastic description of even tapping the emotional aspect. I think that's something which can be an icing on the top. Apart from that, if we feel that even the recruitment process and engaging with other healthcare institution or the recruitment agencies, blockchain technology can come a big way, help in transferring the data, sharing the data with other agencies. Obviously, the security issue will have to be sorted beyond doubt. But I think employees at various levels, they can be monitored well for the clinical quality if we talk about healthcare perspective. In fact, few healthcare institutions have gone to that level. Even for the surgical field, they monitor the hand washing time as well in the ICU and operating rooms, so that they can relate at every point. Like you walk in this hall, everywhere they're checking their, noting down the QR code, and at the end they decide, okay, which is the hall which is most popular, how many people are traveling to one for to the other. So likewise, we have some QR code mechanism to see the movement of the staff as well, especially from the sterile to the non-sterile corridor, and also the flow of the dirty and clean linen. I think a lot of things can be done within the organization, and once you are developed to the mature organization of sharing the data transparently. Unfortunately, in India, healthcare cannot portray their complication rates online. That's something which we have to mature to, just like Cleveland and Mayo, they publish their results, whether it is good or bad. But with the help of technologies, I think we are going to cut down on the complication by having a seamless movement of the staff, also the engagement and their behavior. And also in future, we have to mature to that level where these information can be shared within the with other organizations, healthcare institutions, also with the policy makers.
Thank you, sir. Neeraj sir, it's an icing on the cake what you touch technology on the touch points of human psychology of patient. What other areas do you think, or as a corporate your people are working, which you think can the technology can play a very crucial role?
So since we all work in a corporate hospital, so like P&L, bottom line and top line. So we have a software known as 𝗦𝗡𝗏𝗏. So what we used to do in OPD, like average daily footfall in one of the hospitals, suppose 1,000 patients. So it is very, very difficult how many patients you retain for pharmacy, diagnostics, or say for example for a future procedure or a surgery. So it has been seen 37% of the patient you lose because there is no engagement with the patient. So what we have done, so whenever a doctor is doing a consultation over a 𝗦𝗡𝗏𝗏 app, so he's spending more time in seeing the patient rather than a typical medical college scenario where they keep on writing on a prescription. So there is a templates for different specialities. So there is a software, he's speaking and automatically a prescription is made. And whatever pathology, radiology, pharmacies, then it is done. And then there is something known as CPOA, clinical prescription order breaking. Whenever this patient goes out, a pharmacy, the prescription is not given to him physical. It is mailed through a WhatsApp or his mail. And whenever he go to the pharmacy, a pharmacy bag is ready. He go to pathology or a radiology, it is being done. And then for the future engagement, you are attached with the patient for a procedure or a surgery. Because they go to a CT scan and it is a big queue. So these things happen. So one thing is that which we are using technology is making a sense. Second, we are making a hospital a silence hospital. So if you enter to a hospital like here, we are sitting and you just close your eyes and see, we are hearing a very noise again. And this is much more than your, so our customer care manager, we have given a TV meter. So they keep on checking the sound and we are giving plugs to the patients and the people so that they can use more and more these things. And we have among all two hospitals we say, which is a silence hospital. So these are the things we are using the technology for the better patient.
Thank you, Neeraj sir. And that was something really wonderful. Upasana ma'am, coming back to you, how do you think, adding to what Neeraj sir has said, technology can help in achieving a better patient care output or a patient care service? How technology can play, or what Yashoda as a corporate is doing so?
So, thank you, Rakesh ji. Actually, he is right that now technology is playing a major role for patient care and patient safety. So nowadays there are new devices, there are inventions of different kind of devices that somebody has given us a device we can put under his mattress, and in a ward or in a room where no doctor is available or no monitor is available, we can monitor his vitals on nursing station. So these things are really good, and after some time actually the way our population is growing high and our trained staff and skilled staff is going abroad. Rather, the government is trying very high to make new nurses, like they have announced that we are going to start 158 new nursing colleges and medical colleges. At the same time, they are going abroad and we are growing all the hospitals. Now I should say the amount of hospitals are coming in India, that is also amazing. In an area you will find many hospitals are coming together. So how many manpower you will get? You can't meet the need of the patients. So technology will definitely play a role. Same time, technology will not differentiate with the patient. Like sometimes your nurses are busy with chatting to each other and they don't, cannot listen, or because of any reasons your ward boy is not there. But technology is always there, and technology can actually, I think it is going to improve more. Like I came across with some new technology, that photonic. You can display your advertisement anywhere, like I can display my hospital in New York, and our patient or our buyer can scan from there and book from that barcode to us. So these kind of inventions are going to be very helpful for the healthcare industry, because we need more and more patients, not only from India, from abroad, because our high-tech hospitals, like Dr. Neeraj, I must congratulate your hospital that you are doing great job. So, because Apollo is pioneer in this field, so they are always adopting every new technology. So I think after some time every hospital has to adopt technology. But I have just one thing to mention everyone, that technology can play a major role, but nobody can take place of a hand of a doctor. That hand who is saying, yes, everything will be okay, don't worry, I am here. So robot cannot do that, otherwise everything can be done by the technology. Thank you so much.
Very well said, ma'am, and we all believe every person sitting in the hall agrees to that touch and feel. Coming back, Dr. Young, how do you think as a country, India and Taiwan can leverage each other and help in developing some technologies for upcoming smart hospitals? You gave a very good example about ENT problem. How else both the countries can leverage each other and have a very good outcome?
Okay, thank you so much for the questions. Comparing to India, Taiwan is actually a very small country. We are actually located in a very small island. But the people live in Taiwan. We are used to, to do two things. One is adaptation, the other one is customizations. So basically, we like to adapt to new technology, since we can, receive all the information even from Japan, from Korea, even from United States. And people tend to get to adapt to this technology. And the other thing is, since our land is so small, so when we say like build a hospital or build a new building, we don't have so much land. So we have to customize things to fit our needs. So for example, in Thailand, in my university, we are actually building the very first hospitals only for elders in Taiwan. And that hospital is actually a small hospital. So basically, what we are doing is we are not like the normal hospital patient come to the hospital, they first see maybe the medical doctor from the family medicines, and then the doctor will give some diagnosis and then refer the patients to the different department. So patient has to go around in the hospital in a different department. That takes a lot of time. So in the smart hospital, what we are doing is when the patient comes in, actually we make the center, we make the patients as the center. So we use some of our AI technology, so we can do the diagnosis, and then we form a team, a team to fit the needs of the patients. So for example, this patient needs some help from the dentist, or maybe needs from the ENT department. So we will form a team to help these patients and to let him get the treatment right away. So in terms of building a smart hospital, I think I would say the strengths of India would be you have a lot of smart people, and we actually when we talking about the smart hospitals, you need a lot of the AI model to get in, since the labor in Taiwan is actually very expensive. So we're trying to use a lot of AI models to replace human, but in order to build these AI models, we really need a lot of programmer to do that. So I think that's something India can help us to, get stronger in terms of building smart hospital. Yeah.
Thank you, Dr. Yung. And I believe we as a country would always love to do that. And sooner or later, or rather very soon, on behalf of all the medical fraternity, I can vouch that we would be a leading smart hospital country and a face value to the entire world. Thank you all the panelists. Anyone has any specific question can just ask.
Can you please give the mic?
Thank you very much. It's a pleasure having you candidates. I'm very glad to be amongst you, sir. I've been meeting you, but now with a disability, I'm more restricted. So my question on the topic, and Rakesh, with what you spoke prior to this. So I thought smart is one part of the story. The second part is the safety part. Do you think there's a need to make safer hospitals? I mean, I would like to address this question to the entire panel. Are they satisfied with the safety element?
Of course, I think Commander Bali, anyone wish to take this? Commander Bali, sir?
If a smart hospital is not safe, it is no good at all. So I think to answer your question, it is of paramount and pertinent, of great importance that as we move towards better technology, usage of technology to do a lot of many things. I think the ultimate goal, as Dr. Young was also saying, the patient has to be in the center. And one of the leading causes of death in US even today is just that you get admitted in the hospital. You don't have to do anything at all. So hospitals are not very safe places even today in the most developed countries. If we are going to be moving towards better technologies, using digital means, using AI, using Internet of Things. So I think all these have to point towards a much more safer hospital. We have a long way to go. Accreditations like JCI, NABH push you towards doing those things, but as we are very well aware, at the time of accreditation, a hospital retains a level of safety Many times it goes down over a period of time, some of them retain it. But yes, to answer your question, more better use of technology will have to make hospitals much more safer. Otherwise, it's no good at all.
Very well said, sir.
Yeah, one part of this story.
Please.
And this is the answer from Dr. Aashish, being a surgeon yourself. What is your goal ultimately when you operate on a patient and the patient is about to get discharged after a stay? I have an experience I have shared with you.
Okay, so talking about the safety aspects, I have my own personal experience with use of robotics in my own joint replacement. So I have, after the initial learning curve which I achieved, I decided that there has to be a active surgeon's intervention in deciding how much to use the robotics for executing the procedure. So if we blindly follow the machine, we end up doing a disaster. So it has to be taken with a pinch of salt. All these technologies are evolving. Whatever inputs you give into that is a huge amount of learning curve involved. So yes, these technologies are making the things better. In fact, patients come and ask for a robotic procedure. Sometimes I dissociate that don't go for this, it's not good for you. So we have to strike a balance between using the surgeon's mind and experience or a clinician's mind and experience versus blindly following any technology for that matter.
Yeah, very well said, sir. What my point is that you've done a very beautiful job. I think, does your goal end at the point of completing surgery or is it at the end of discharge of the patient?
Not at all, not at all. Until I am able to see my patient running again and going back to his life without any follow-up with me, I think that's the end point.
So my question again, the next question is obviously that it is very disheartening when you see a good outcome going into a tangent of a bad outcome. And then you do the auditing. I think Dr. Ritu will also share with me. What we did some extent with your hospital a few years back, you recall. And yes, Dr. Neeraj, when you said pioneer, yes, what was the pioneer?
I think it's better let him answer this.
Generally speaking,
Yes, yes.
because it is relevant. I had this spinal fracture last year, CPC 4 at Ahmedabad. It was connected very nicely down to my previous diabetes. But I got up with a 𝗕𝗨𝗜𝗍𝗔𝗟𝗏 from my right hand and the other leg. This was just what I used to be speaking. Yeah. So my point is that what is your goal setting? When you talk about the outcomes, we can all see the outcomes. Acquiring of digital bots and AI and all of that.
So we got you. I think let Neeraj ji answer this. Yes.
See, one of the aspect of safety is cyber safety. I think we all talk about this. I think hospital is the only place where you can take any data. You must have seen AIMS, what happened to AIMS few months back. So now National Forensic Science University have started a safety audit. See, we do financial audit, we do clinical audit, but I fear no hospital is doing a cyber security audit. So now these people are doing complementary. There is an institute available in New Delhi and Gandhinagar. They come to your place, they see your servers and everything. So I think one of the ways, safety is very broad. So I'm just talking about a cyber security. I think hospital also should use cyber security audit in order to see whether what are the apps you have made, whatever servers you have taken, or whether it is on cloud or wherever, whether they are safe or not.
Thank you. Yeah,
May
please.
I add to your question, patient outcome? Yes. So I just want to add one thing because I was in another conference before reaching to this place. NHS is going to give a category to the hospitals, kind of star rating. So, and for medical value travel, every hospital has to show their patient outcome. Like if they have done this number of surgery, how many patients are perfectly fine, how many has gone for some problems, so it was near miss or something like that. So overall this exercise is going to give benefit to the patients and I think every hospital is reviewing their patient outcome. So it's a regular practice to the hospitals, and I think you can choose your hospital going by their star rating after some time. Thank you so much.
Very well said. Thank you. We have the last question.
Delighted to have a young dentist from Chen from Taiwan in the government sector amidst our corporate bigwigs. We truly hope that this technology will bring down the cost so that the word is outreach in healthcare in India. Middle class in our tier 2 cities, even in our metros, as well as the poor in the rural area. So what we want is that just to equality of arms, bring people from the government institution just to compete with them, because Indian healthcare is not science. The technology should outreach the primary healthcare. Okay, there is one medical college called Mahatma Gandhi Medical College. It's very cost effective. You see, they are billionaires. They have got the stage, and they develop the policy in India. Unless, if you want the country to improve like China, we got wealth of pathology here. Okay, so it has to be upside down. Just like business, the pathology is in the bottom of the pyramid. So technology should percolate to the primary healthcare, not to the tertiary healthcare. Tertiary healthcare will bring Indian healthcare to we are very poor in our healthcare. Remember this. Thanks to this corporate healthcare and their lobby. Thank you.
No, sir, the government is also doing a lot.
You should bring the government here.
They are also doing a lot, sir, and very soon in every district of the country we will have a medical college and university.
They can sponsor all these conferences. They are the same way. But all the doctors come from the poor medical colleges. Next time, otherwise it is not a civil act.
Fully agreed with you. Next time we will try this.
I think keeping everybody's schedule in mind, we should move ahead. So I would like to thank for leading this session for us. Can we have a big round of applause for this insightful and informative session from our esteemed panelists here? Now I would like to take this opportunity to felicitate all the dignitaries present with us for this session. I would like Mr. Sharma to facilitate the co-panelists. Ms. Upasana Arora. Commander Navneet Bali. Dr. Ritu Mittal. Mr. Neeraj. Dr. Aashish Chaudhry. Dr. Yung-Chung Chen. Now, I would like to invite Dr. Navneet to felicitate Mr. Sharma. Also, I would like to thank Apollo Hospitals, Yashoda Hospitals and Narayana Health for partnering with us for this event. Can we have the partner certificate, please? Can you please stay on the stage for the partner certificates? Thank you all very much for being with us for this session. Moving on to the next panel for today. Medical technology has revolutionized healthcare delivery by introducing new and innovative ways of providing medical care to patients. The adoption of these technologies has led to a significant improvement in patient outcomes, reduced healthcare costs, and improved patient experience. On our next panel, our experts will be discussing the different ways in which MedTech is changing the scenario of healthcare. Please put your hands together for our distinguished panelist, Mr. Rajiv Nath, Managing Director, Hindustan Syringes and Medical Devices and Forum Coordinator, AMED. Can we have a big round of applause? Mr. Manish Sardana, President, Polymedicure. Dr. 𝗕𝗡𝗧𝗘𝗥𝗡𝗙𝗧𝗜𝗢𝗏, Clinical Sales Director, Intuitive. I cannot hear your clapping. Mr. Kshitish Kumar, Vice President, Philips Health Systems. Mr. Sanjeev Lahiri, Business Head, India and SAARC, Medillion Enterprise Corporation. I would like to now invite the moderator for our session, Mr. Sanjay Jha. He will be moderating the panel for us today.